Imagine waking up one day feeling completely drained. Your energy is gone, you bruise easily, and your gums start bleeding for no reason. What if I told you these are early warning signs of a life-threatening cancer? Acute leukemia is an aggressive blood cancer that can take over your body in just weeks. Today we're breaking down exactly how it happens, how it starts, the warning signs, and the latest treatments that can save lives. And we'll explore two real-life cases, one of an adult with acute myeloid leukemia and another of a child with acute lymphoblastic leukemia. What is acute leukemia? In simple terms, acute leukemia is a type of blood cancer where your bone marrow starts making too many immature white blood cells, called blasts. These cells don't function properly and start to multiply uncontrollably, crowding out healthy blood cells, which leads to anemia, infections, and bleeding. The signs and symptoms of acute leukemia is the tricky part. Leukemia doesn't have one clear symptom. It mimics common illnesses like the flu, strep throat, or even just fatigue from stress. Some common symptoms include B symptoms, which is persistent fever, night sweats, and unexplained weight loss. Bone pain, which in children presents with bone pain in arms and legs, while it causes back pain in adults. Anemic symptoms include weakness, fatigue, pale skin, and shortness of breath. Bleeding issues includes frequent nosebleeds, bleeding gums, easy bruising, and heavy menstrual periods. Infections can be chronic or severe, including ulcers and oral thrush. And lastly, it can include swollen organs with enlarged spleen and swollen lymph nodes. One important clue may be fever that doesn't go away with normal treatments. The first clinical case includes a 63-year-old man who started feeling extreme fatigue and had bleeding gums. He also noticed tiny red spots in his mouth called petechia. His doctor ran some blood tests. The complete blood count showed low platelets, low red blood cells, and blast cells. The patient had acute myeloid leukemia. The second case includes a 70-year-old boy who presented with low-grade fever, pale skin, and swollen lymph nodes. His chest x-ray revealed a huge mass pressing on his windpipe, a classic sign of T-cell acute lymphoblastic leukemia. The diagnosis involves blood tests and bone marrow analysis. The key tests are complete blood counts, which shows anemia, thrombocytopenia, neutropenia, and blast cells. Peripheral smear, including blast cells and hiatus leukemicus, which basically means that the blood has blasts and mature cells without intermediate forms. The bone marrow biopsy, showing blasts more than 20%, confirms leukemia. Flow cytometry, or FISH, differentiates AML from ALL. Lumbar puncture detects neuroleukemia. A bone marrow biopsy is the gold standard for leukemia diagnosis. The treatment of leukemia has multiple phases. Initially, it includes induction, which is done to achieve remission, and includes different schemes in AML and ALL. The goal of this is to destroy blast cells, and remission is when blasts are below 5%. In ALL, the next step is CNS prophylaxis by using intrathecal chemo. After that, in both ALL and AML, intensification or consolidation is used. And this is done to destroy cells resistant to chemo. And the final step is maintenance therapy, which is done to maintain remission by using a low-dose chemotherapy. ALL generally has a better 5-year survival than AML. Children and adolescents have higher survival rates, and early and aggressive chemotherapy improves prognosis significantly. Thank you for watching. If you found this video helpful, give it a thumbs up and subscribe for more medical content. See you next time.